We got you the best help in the business, man. We got Dr. Ari Brown at our table. Dr. Ari's in the house to answer questions from real moms.
Kids do bizarre stuff.
The most challenging thing about being a pediatrician is not taking care of the kids. It's taking care of the parents and making them feel like they can trust their instincts and helping them realize they don't need to worry so much.
Easy acronym, sleep, okay? S, set up a routine, a short and sweet one. L, less is more. Less intervention, more sleep. E, empower the child. They're in charge of falling asleep, not you. E, earlier bedtime. They're not overtired. That makes it harder to fall asleep. And P is plan together and stick to the plan.
When I look at that, I don't ask myself why they're doing this. I ask myself, why would they do anything else? You're paying them off like a slot machine. So what do you mean by empower the child?
They're both capable of self-soothing.
What is now the very best baseline advice to give to concerned parents?
Well, I think the more information we give to parents, the better they can bring those concerns to the doctor even before their one-year well check. If they're seeing signs where their child is just not engaging with them, doesn't seem to respond like other children, bring those concerns up and they can be checked out. We're not taking a wait-and-see approach anymore.
Dr. Ari Brown, who's joining us tonight from San Francisco with the American Academy of Pediatricians.
What are we talking about in terms of certain ages and eating habits?
Right, my own kids, they only ate beige food when they were toddlers.
Beige food?
Beige
No
food,
green
that was it.
vegetables?
And now they eat oysters and sushi. They're very expensive taste, but at least they eat a variety of foods. And so what we're looking for is the big picture for right now. You know, what does your toddler eat over a week? We want to know, are they getting too much fat or too little? The American Academy of Pediatrics actually recommends whole milk until the age of 2, and then they have to have a low-fat diet like the rest of us. We're looking for calcium, we're looking for iron, and then we do want to know if they eat anything green.
All right, again, but if one meal is not great,
right,
as long as later in that
right,
week they pick that stuff up.
Exactly, and don't be a short order cook.
He gets very frustrated and can't seem to keep his train of thought, so he'll put his hands over his ears, and I asked him, why do you do that? And he said, because I can't hear myself. Is there something that I can do to help him and give him tools not to get so frustrated?
Do you have a tool for her to use?
Right. So A, validate it. Say, you know, it's okay to feel frustrated when somebody's interrupting you. And B, it's important to empower him with a strategy and say, you know what, I'm talking right now, it's my turn. And
So
that will give
him
him some power in the situation, and that's really what he's looking for. Bet you didn't know that the average child gets 8 viral infections a year, each lasting 7 to 10 days. That's about 80 days of illness. So if your child has a snotty nose every other week in the winter, he's normal. One thing that's important to talk about for college entry freshmen is actually the meningitis vaccine. And it is required in some colleges, but it's optional for others. But it shouldn't be optional for your child because that is the #1 form of meningitis in freshmen who are living in dorms. And it's one thing you can do that's so important to protect your child.
And there does seem to be some increase in meningitis cases as well. You know, Dr. Brown, if you write a book called Co-Ed 411, you can recommend cooking classes to all those incoming freshmen as well.
Okay.
Listen, thanks so much for joining us. A really good show. I appreciate that.
Thanks for having me, Sanjay.
All right, more House Call coming up.